Do14 is on the posterior midline, below the spinous process of C7 in a depression. Do12 is on the posterior midline, below the spinous process of T3. Do4 is on the posterior midline, below the spinous process of L2. Bladder 31 is within the first sacral foramen. Bladder 32 is within the second sacral foramen. Bladder 33 within the third sacral foramen, and bladder 34 within the fourth sacral foramen. Pericardium 6 is on the flexor aspect of the forearm. It's 2 cm proximal from pericardium 7, and it's in between the two tendons palmaris longus and flexor carpi radialis.
Bladder 60 is located directly posterior to the prominence of the lateral malleolus. It lies in the deepest dip between the posterior border of the malleolus and the anterior border of the tendocalcaneus. Spleen 4 is located in a depression which is distal and inferior to the flare of the base of the first metatarsal. Feel along the inferior border of the first metatarsal, find the flare of the base and place your point in between that flare and muscle. Spleen 4 is about 1 cm proximal to spleen 3. Be careful when palpating along the inferior border of the metatarsal that you don't overshoot the head and find this nice dip in between the medial cuneiform bone and the base of the metatarsal. It's a nice dip, but it's not spleen 4. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella. Spleen 10 is located 2 cm superior to the superior border of the patella in a tender depression on the height of the muscle vastus medialis. We know the patella is 2 cm long, so we can use this to calculate how high up the leg this point should be. A common mistake is to mark this point too far anterior or medial. A good location tip is to have the person press their leg down into the bed, which will bring vastus medialis into relief, and you should be able to palpate the depression in the height of it that forms spleen 10. Do20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do20 is located 1 cm posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other dew points, so don't be tempted to go further back than 1 cun posterior to that midpoint. Large intestine 18 is located on the side of the neck on a contour with a laryngeal prominence. It's in between the two bellies of the sternocleidomastoid. To bring the two bellies into relief, have the person turn their head against resistance. It becomes quite easy to see the sternal and the clavicular bellies of this muscle. Locate your point in between the two bellies and then have them relax their neck again.